Greetings. I'm Dr. Lipi, and welcome to my show, Health, Humor, and Harmony. Today's top medical topic is one that's very personal to me. Today, April 25th, is World Malaria Day. When I was 11 years old, the month of April, I started having very high fevers of 104 Fahrenheit, as well as shaking chills, cycling back and forth for hours. Panicking, my parents drove me to the pediatrician, who immediately had me admitted to the hospital. After running a battery of tests, the medical team diagnosed me with malaria. So, how did I get malaria, this tropical illness, while living in Toronto, Canada? And what kind of treatment did I get? Stay tuned to find out. According to the World Health Organization, World Malaria Day is an occasion to highlight the need for continued investment and sustained political commitment for malaria prevention and control. This day was instituted by WHO member states during the World Health Assembly of 2007. On April 25th of each year, the CDC joins the global community in recognizing World Malaria Day. The theme for 2022, quote, harness innovation to reduce the malaria disease burden and save lives, end quote. The reality is that no single tool available today will solve the problem of malaria. The WHO is calling for investments in prevention, diagnostics, medicines, and other tools to combat this global infectious disease. So, why the urgency with malaria? Despite steady advances in lowering the global burden of this parasitic infection from 2000 to 2015, malaria remains a leading cause of preventable illness and death that continues to have a devastating impact on on the health and well-being of people around the world. According to the WHO's latest World Malaria Report, in 2020, there were approximately 241 million cases and 627,000 deaths caused by malaria worldwide. What's more alarming is that 3.2 billion people, that's half the world's population, are at risk for getting malaria. More than two-thirds of all malaria deaths are among children under the age of 5. So, what kind of disease is malaria? If you live in the US and you're not too familiar with it, I'm not really surprised. Malaria was eradicated from the United States in 1951, led by the National Malaria Eradication Program. About 2,000 cases are still diagnosed in the US each year, mostly among travelers and immigrants returning from regions where malaria transmission occurs, including sub-Saharan Africa and South Asia. Malaria is a serious and potentially fatal disease caused by a parasite called Plasmodium that's carried by the female Anopheles mosquito. When the infected mosquito bites humans, the parasite can enter the person's bloodstream and cause illness. 4 types of malaria parasites infect humans: Plasmodium falciparum, Plasmodium vivax, Plasmodium ovale, and Plasmodium malariae. Classic symptoms are high fevers, shaking chills, and flu-like illness. So a little bit more about transmission. The malaria parasite is found in red blood cells of infected people. As a result, while transmission is primarily from mosquitoes to humans, the infection can also be spread through blood transfusions, organ transplants, contaminated needles, or maternal fetal transmission, also known as congenital malaria. So, who gets malaria? As of 2020, 95% of malaria cases, or 228 million, and 96% of deaths, or 602,000, worldwide occurred in Africa. Within the African continent, 4 countries carried half the global burden of malaria deaths: Nigeria, the Democratic Republic of Congo, Tanzania, and Mozambique. In 2020, the Southeast Asia region had 9 malaria endemic countries, accounting for 2% of the global malaria burden. 83% of cases were concentrated in India. So, is malaria contagious like the flu or COVID 19? No. The Plasmodium parasite does not behave like respiratory viruses such as influenza or SARS-CoV-2, nor is it sexually transmitted like syphilis, chlamydia, or HIV. A little bit more about clinical manifestations. Other than high fever, chills, and flu-like symptoms, GI symptoms like nausea, vomiting, and diarrhea may also occur, as well as anemia and jaundice from the destruction of red blood cells. If not treated promptly, malaria infection can cause severe complications, including kidney failure, seizures, confusion, coma, and death. Of the 4 species of Plasmodium I mentioned earlier, Plasmodium vivax and ovale can cause relapsing malaria by staying dormant in the liver for several months, even up to 4 years. Plasmodium falciparum is most likely to progress to severe and potentially fatal infection involving the central nervous system, also known as cerebral malaria. So, how is malaria treated? Treatment is guided by several factors, including the Plasmodium species itself, the clinical status of the patient, expected drug susceptibility, and previous use of antimalarial medications. And medications can include Malarone, Coartem, and quinine sulfate, plus doxycycline, clindamycin, or tetracycline, particularly in chloroquine-resistant regions. In regions without chloroquine resistant strains, such as Central America, patients can be treated with chloroquine or hydroxychloroquine. So, how do we reduce the global malaria burden? Effective treatment and prevention strategies need to be implemented in regions most affected. Examples of prevention include insecticide treated nets, preventive treatment in pregnant women and infants, and indoor spraying. In addition, several entities are working on a malaria vaccine. As of October 2021, the WHO for the first time recommended the large scale use of the malaria vaccine RTSS, or Mosquirix, for use in children living in moderate to high malaria transmission areas. So, there are signs of hope. I remain optimistic because of the progress made globally thus far. Several countries are moving quickly towards elimination. In 2020, 26 countries reported fewer than 100 malaria cases, up from 6 countries in the year 2000. In 2021, 2 countries were certified malaria-free, which means 3 consecutive years of zero indigenous cases: China and El Salvador. And worldwide, 40 countries have achieved this major milestone. So, what happened to me when I was 11 years old? I had traveled to India with my family in August for about 3 weeks, but I didn't develop any symptoms until the following April. So, I most likely had Plasmodium vivax or ovale harboring in my liver for about 8 months. Thankfully, I was diagnosed and treated promptly, and I was given oral antimalarial medications, which I took every day for several days. If not, I may not be here today. So I am very grateful to the medical team that took care of me. So, why did I get malaria and nobody else in my family? Well, blood type can play a role in Plasmodium susceptibility. But in my case, I can tell you that I wasn't very compliant with the malaria prophylaxis. At the time, I had to take weekly chloroquine pills, which were huge and super bitter. I swallowed partial doses, but then I spit the rest out, while at the same time getting bitten nonstop. So while I was unlucky to get infected, I was very fortunate to have received prompt and first class treatment. We need to make sure that all people, particularly children who are diagnosed with malaria, receive prompt and effective treatment the same way that I did. So, what can you do to fight malaria? You can learn more about this parasitic infection from the WHO, the CDC, and the RBM Partnership to End Malaria. And you can donate to or volunteer with organizations such as Malaria No More, Africa Fighting Malaria, the Global Fund to Fight AIDS, Tuberculosis, and Malaria, and many more excellent organizations fighting this disease worldwide. Well, folks, that's all for today, but not before the joke of the day parasite theme. What did the mosquito say to its therapist? Everyone says I suck. Tune in this Wednesday, 3 p.m. Eastern, when I'll be discussing World Immunization Week. And be sure to subscribe to my YouTube channel and follow me on Instagram at Health Humor Harmony Dr. Roy. Be well. I'll see you soon.